Hey everybody, my name is Jamie Dooley. I am the founding director of the National Network of Healthcare Hygienists. I am here today with Katharine Martinez. I am so super duper excited to get a little bit of information and feedback. She, I'm sure many of you have seen, is one of the features of, was it Dentistry IQ, Katharine?
Dentistry IQ, yeah.
We have on our main homepage right now for our Oral Systemic Educator certification. Her title is Oral Health Educator, and she is part of Phoenix Children's Hospital.
Phoenix Children's Hospital,
Katharine,
yeah.
welcome so much, and thank you for speaking to me. Go ahead and introduce yourself and tell us a little bit about your role.
And thanks so much for having me on here. It's super exciting times. My name is Katharine Martinez. I'm the Oral Health Educator at Phoenix Children's Hospital. It is a grant-funded partnership with Delta Dental of Arizona. I've been in the role about, I'd say, a little over a year and a half now. And kind of starting from the beginning, so Delta Dental of Arizona had an idea of how they could integrate in the community to improve oral health care for the children of Arizona. And they had a networking partnership with somebody from Phoenix Children's Hospital's Foundation. So they went and took their information that they had and what they wanted to do to the foundation, and the foundation worked with the chief nursing officer, Dooley at Phoenix Children's Hospital, to try to figure out how we could incorporate an oral health provider into the hospital setting. So it took about 2 years of collaborating, and not too much of what they knew what they wanted to do. They were, do we fund a dental clinic on site? Do we fund a dentist? Do we have a hygienist come in? So it was back and forth for about 2 years as to what they wanted, and they originally settled on a dental hygienist to come in and perform education. For what they really wanted was somebody who was an oral health provider to reduce hospital-acquired infections. So then my role was developed, and they had me come in to the hospital, sit with the executive crew of the entire hospital and Delta Dental of Arizona's executive board, and put together a presentation as to what they think that we could do in the hospital setting. So it was me formulating an entire presentation to all of them to say, here's what I can do, here's how we're going to formulate a plan, a program, implement it into the hospital, and carry it out for a long-term success of the patients and improve treatment outcomes while also decreasing hospital-acquired infections.
That is so fantastic. I get goosebumps because I've visualized this and prayed for this for so long, as so many hygienists have. We know that we can be successful in these types of roles. How nerve-wracked were you sitting at that big boardroom table? I've done the same with upper-level hospital admin, and it's nerve-wracking, hey?
Right. It was pretty surreal. So originally, it was just the chief nursing officer and the VP of professional practice, and that was the first kind of meet and greet interview. And they said, they asked me, like, do you have questions for us? Because we don't really have any questions for you, because we don't know how this role is going to kind of go into a hospital setting. So it was a weird kind of dynamic when you're interviewing for a role where they don't even really know any questions to ask you. It's me asking all these questions. How do you guys see us in there? What do you think is going to be the plan? And they're like, we don't know. Like, that's going to be up to you. So then they picked the top 3 candidates, which was, there was 6 dentists, there was 2 PhD hygienists, 2 MPH hygienists, a couple other hygienists, and so they formulated it down to the top 3 to create a presentation. So it was me and 2 other dentists that came to do the presentation. And so the presentation was, it was recorded, so that way it could go back to Delta Dental of Arizona. And they said from all ends, Delta Dental and Phoenix Children's Hospital, after we were done with the recording and after they had listened to the other 2, I was the last to go. They said it was a unanimous decision among everyone that it was going to be hands down me. And I was like, I don't even know what I did,
Wow.
But they were like, yeah, it was a unanimous decision among everyone. Yeah. And so I was like, oh my gosh, obviously I did something that struck an interest with them. And, and honestly, it was just me going through what I had learned in hygiene school.
Right.
How do I talk to kids? I did a video of myself educating with a puppet, how to do oral care on a puppet, kind of incorporating hematology, oncology, and how I would talk to a patient who's a child, how I would talk to family members, but then also formulating a program as to how I would do assessments and how I would work with the doctors and the nurses and the caregivers to perform that oral care in the hospital setting. And so I think I gave a well-rounded approach as to how we were going to do everything, where, it just shows how our education really put us up for that task, because dentists didn't have that. They didn't have that mindset to develop a program and formulate education plans and everything like that. They were more of the mindset of, oh, we can do restorative work and we can look in the mouth and we can assess, but they don't have any other education plan to go from that. So I think that's what really they were. Yeah.
So
they were like, no.
You had that natural program development mindset and heart, because having that heart is so important too. And to your point, we're the primary care specialists of oral health, and they're not. They're the treatment specialists. So I'm so excited because that story right there proves that we do not need advanced education. We don't have to go back and get our master's of public health. If we want to, great. It'll serve us, but it's not a requirement. It's the passion, it's the knowledge, and it's being able to see that big picture and go in without the plan already laid out.
Right. And I had a phone call with a dentist in the Philippines the other day, and I said, what you really need is you need a hygienist who can think outside the box. Because if you're just going to be a hygienist who's just going to follow the rules and like, oh, I can only do this and this is only what I'm able to do, if you're not able to think outside that box, you're not going to be successful. It's going to take a forward-thinking person who says, I question why. I question why all the time, well, why does it look like that? Why does the mouth look in that manner? How does the mouth, and talking to the providers in a way that they have no idea what they're talking about. The doctors have no idea what they're talking about when it comes to the mouth. They're like, well, what do you think? And I'm like, oh, well, this is what I think, but you should know, you're the doctor. But they're like, no, we want you to tell us what you think, because we value your opinion, we value your role. So
and hygienists are less expensive for the systems, right? So a dentist is going to want somewhere between $200,000 and $300,000 typically. We're happy with 50 to 80 in full benefits, on average, depending on what state you're in. And so from a healthcare administrative perspective, we make more sense because we're preventing disease, which is going to save money and improve outcomes, and we're less expensive. It just makes sense.
Well, yeah, and honestly, now that I've been in the setting, they said, even if Delta Dental doesn't continue to fund you, we're going to find a position for you, because they see the benefit in it. And so it's kind of going to be creating my own position going into the hospital. If they want to continue to fund it, I'm on board with them funding it. But the hospital's like, well, we don't need them to fund it. We know what you can do now. So I kind of established my place in there. And, and honestly, it's not going to be a place of billing out as a hygienist. So I'm not going to build in a hygienist setting. It's going to be more so what I can do for the hospital setting to reduce infection, because we know one ventilator-associated pneumonia event, one central line infection event costs the hospital anywhere between $50,000 to $80,000 per patient per infection. So if we're able to reduce 2 of those a year, our entire salary is paid for that entire year, which there's way more that happens, in a hospital setting. And we have now the research to show that it's directly linked to oral bacteria, these certain things that are occurring, like the ventilator-associated pneumonia and then the MDI, mucosal barrier injury, central line infections.
Right. So how are they billing, or are they not because you're grant funded?
So right now we are not getting billed out. So I am completely grant funded 100% through Delta Dental of Arizona. They're even covering my benefits and everything. So it's pretty much just I'm in the hospital setting. I'm a PCH employee, but completely funded through Delta Dental of Arizona. So in the future, I think when we go forward and, based with the legislature, here in Arizona, we can work underneath, like as an affiliated hygienist hygienist under the physician. So that order has been in place. So in that sense, we could probably go forward and start to bill out as a hygiene, and going in and when we're doing our assessments and what we're recommending to the doctor to prescribe or going forward for the treatment, then we could start to bill out in that manner. But as of right now, it's too hard to figure out the dental medical insurance. But it would be easier in the hospital, Phoenix Children's Hospital setting, in the Children's Hospital setting, because they are Medicaid primarily. I believe we see about 70% of Medicaid access patients. So we could get the dental funded for the hygienist to go do the work like an FLP, an OT, a PT.
Yeah.
So it's a work in progress.
Yeah. So you're working to the top of the scope of your practice, and you can work under a physician, not a dentist. Is that correct?
Yeah. So I currently do not have an affiliated practice. So I'm currently don't have any other extra licensure. I just have my RDH and I have my MPH. So I don't have that affiliated practice. If I want to go forward and get that affiliated practice, there's probably more I could do, more clinical. But right now the hospital's like, no, we don't really have you in doing anything like in a clinical capacity to need that. So I think that's going to be beneficial going forward for other hygienists who want to get into the hospital setting, because right now I'm doing everything within my scope of a role of a hygienist. I'm doing clinical assessments for the sake of education. I take what I'm visualizing inside the mouth to go and educate the doctors, the medical residents, the nurses, the PCP. I go through and I can use that information. I'm not diagnosing. I'm just using that information to educate what's going on in the future. I'm not going in there with a dental instrument and cleaning anything. I'm not doing anything in that manner. So it's pretty much just solely education based and using assessment for education purposes.
And that's exactly how we've got our oral systemic educator certification structured, because every state is different. The focus is on assessments, education, and referrals. And so you're just lucky because you're in a hospital setting, but you still probably do. Do you do any referrals outside to dental treatment?
So there has been cases where the children have like gross decay or something throughout the mouth that they do need to see a dental provider. And navigating a dental home for them, it kind of is tricky when you're in the hospital setting because they don't want to give preference to a certain provider. So you have to go through and kind of give a list. So what I can do is I can look up their access insurance, look up a provider, look up their address where their house is, give them a 2-mile, preference as to like 10 providers, maybe some that have the language that they speak. So it's in like a dental navigator role as well, included in all of that.
Yeah,
but it takes so much time. So that could be a whole dental hygiene role just in itself, right there.
Totally, and for adults too. To your point, I love that you said in your interview that your goal is now to have an oral health tab on all the adult charts too within the healthcare system, which is so needed and so beneficial in the kids charts. And now the system can see that. So you are trailblazing. You are breaking new ground. You're a thought leader, and we are so happy to have you to model after. Have you guys thought about using the nurse visit code at all? That's one of the things that we've been looking into as a potential for a pilot program.
If there hasn't been any talk about that, that's something that we can look at in the future. I don't know.
Professional. It doesn't say like RN or LPN or MA. It just says it's ordered by a physician, and it takes approximately 10 minutes for the purpose of some type of assessment or referral or education. And I thought this might just work because an RDH should fall under that auxiliary professional. The physician does not have to be present. So you and I should talk about that later after the interview. And I'd love to see you go to your admin and see if they're willing to try it.
Right. Yeah, no. And I mean, I don't think right now they would probably bill out until the grant has ended. But when the grant funds end, then that might be, because then it would be like double dipping. So, but yeah, no, definitely talk to them about that. And then I think that's something in the future that's a for sure thing that we could utilize. They just don't know it yet.
How long do you spend with each patient on average, do you think? Let's say each, what do they call it in Medicaid? There's a visit, there's a word there, encounter.
So usually I would go into a room, and it kind of just depends on the patient, the case that the patient's experiencing. If it's a bone marrow transplant, a new admit that's going to start their bone marrow transplant treatment, it's pretty lengthy, like maybe 10 to 15 minutes. So I go through, do a full assessment, then I talk to the patient, talk to the family about treatment that they're going to do, what the side effects of their treatment that's going to happen, what to expect as far as, when they're getting their infusions, either using the cryotherapy, what type of chemotherapy agents causes side effects for the mucositis to occur, how we can prevent it. Hopefully, they don't exacerbate, get it so bad that they can't do anything at the time. Discuss, making sure that when they're starting to feel any pain or anything, that we start getting them on the pain pump right away. So that way it can limit the amount of pain that they're in so they can continue on with their oral care. Talking about different products, how to use those products, how to space out the product accurately so that they're using it to the full effectiveness of each product. Kind of just going through and just kind of educating, and then I like to sit down and spend some time and get to know them too, because usually if all goes well, keep our fingers crossed for all of them, it's about 30 days that they're inpatient during that bone marrow transplant treatment. If there's complications that arise or there's massive side effects that delay the treatment, sometimes we've seen patients that are in there for 150, 200 days plus. So building that relationship. Yeah, no, it's so sad. And, and the families just are so grateful for my position, just because I do have a little bit of the extra time that I can spend with them. And I do sit down with them and talk to them and, get to know them and get to know their families and get to know what other siblings that they have and what they like to do. And the parents, they don't really have anybody to talk to either. So it's kind of nice when they've been in there for so many days plus to have somebody to relate to and sit down and talk to. And I'm like, that makes my position just so worthwhile, because I just love that.
And that's why hygienists make such great coaches, because we already know how to do that, just like a hairdresser or a bartender, right? What a blessing you are to those families.
Yeah, it's such a special, and you develop a bond with them, and then when they leave, and you're like, that is the most incredible thing, you see them walk out of the hospital and you're just like, wow, I did something, I did something to help those families. And then I kept in contact with a couple of them, so they'll send me pictures or text messages or anything like that. And I'm like, wow, it's just so awesome to see them happy and living life now and cancer free. It's just like, oh my gosh. It's incredible.
So rewarding, and there's no scalers involved. How about PPE? How is that different than clinical hygiene?
Well, now clinical hygiene, I think that, they're going overboard with their PPE. It's just crazy what they have to wear. I mean, for the most part, we wear, our safety goggles, we wear gloves, we wear a mask. Occasionally there's rooms where we need to wear the gowns, but every child patient that comes inpatient is getting swabbed for COVID. So we know what their status if they're positive, if they're negative. So we know exactly what we need to be wearing. And we have a certain ward that's just COVID positive ward, which, we do have patients that come through for, hematology, oncology occasionally, or bone marrow transplant occasionally. It's me either going into the rooms if I would like to, or if I can just do provider education with the nurses and the doctors, so that way I can kind of limit that risk to myself, because they like to have limiting as many people to go into the rooms as possible. So I'll either just phone Sarah or talk to the provider over the email, or just go to the provider's office and just discuss with them the care plan for that patient.
Wow, that's awesome. How about NPI? Do you have your own billing code, your own NPI in Arizona?
I don't know anything about the billing.
Okay. So then you probably don't, because if you could have one, I'm sure somebody would have said, here, sign right here. Let's get you signed up. That's another thing that definitely is on our agenda. We'd love to push some legislature changes, but because we're a national network, each state's so different. So we've got to think top down. That's why I'm so excited to talk to you today, because we need a few pilot programs and hopefully some grant funding, which I'm I've worked under grants and applied for grants before, so we're excited for that in 2021 too.
Right.
I'm so grateful that you were willing to talk to me today. I know that you are super busy working from home, as so many of us are, right now during COVID. But stay on with me, Katharine. I'm going to end the interview, but stay on. And everyone that's watching this interview, please know that you're going to see more from Katharine. We're going to keep in touch with her. And if you want to connect with her, if somebody has questions, is there a good way for them to reach out to you?
Yeah, they can, my email, it's kmartinez3@phoenixchildrens.com.
Perfect. Wonderful. And I'll post that when I post this video as well.
Perfect.
All right. Thanks, everybody. We hope that you sign up for that oral systemic educator certification ASAP. Members only get a huge discount until January 1st, and then it's available for even non-members at $14.97.